One of the things that we do with every single client before we do any marketing tactics at all is establish a foundation for them. And that foundation looks exactly at that. It's the after state. And we look at the avatars. So we're not really interested in the procedures yet. The procedures must be solutions to the avatar's problem. So the procedures are sort of over here, and we ally ourselves with the avatar, with the potential patient. And by avatar, I mean people that form the ideal patient for different types of services that you offer. But we look at their before, we look at their after, and we create somebody who represents a good chunk of the people that you see coming through. And we identify, okay, for somebody, they're a millennial, they're 30 years old, they're highly into sports. Maybe you're in a sunny area, they surf, they do this, they read this, they go here, they go to these restaurants. We get a good sort of view, a good read on who this person is. And then we say, okay, great. And this person, they likely will get Smile or they might get PRK, but we don't know because we don't know what they're going to present with. But we have a range of services that might fit them, but we speak to them and what they want as opposed to offer them a procedure upfront. Because until they've had the consult, we don't really know what procedure they want, but we know they want an after. So we really kind of look at the foundation for the avatar. Similarly with a cataract patient, we look at, where do they live? What do they do? If you're trying to attract more premium lens patients, we look at that, what kind of money might they be bringing in. So we get a good sense for who these people are, what they might read, where they might go online, so that we can start to speak about that after and attract them in and basically get people who are qualified leads for that specific thing that you're looking to sell. And similarly with the presbyopic market, this is a great way to expand a practice. Again, looking at the age range of the person, looking at the fact that they're probably looking to read again with glasses, wind back the clock, turn back the clock 10 years and, get rid of the hassle of glasses. Well, that's a huge group of people that does not fall into your typical LASIK candidate area. And yet these people, if you offer some kind of a solution, for the younger, sort of 45 to 55, you might have something like Presbyon, Presbymax, that sort of thing. For the people who are a little bit older, you can start to get into the lens options. But basically, we don't talk about that because we just want people to recognize, yeah, I do want to get rid of the hassle of these reading glasses. I really, really don't like them. Because if you like them, that's not a candidate for you, right? So you're trying to sort of get somebody to raise their hand and say, I have a problem and I am interested in a solution if one exists, and I might not even know one exists. But then as soon as you've identified, yeah, these people in this age range with this challenge and this frustration is somebody I can start to talk to, that changes the game entirely. So take your services off the table, start to look at your avatars, and really gear your marketing around your after states. And then at the consultation, start to provide them with your professional expert recommendation on what it is that best suits them. Don't let them make the decision. That's your job. Your job is to just let them know, hey, we've got you. You have this problem. I can help you, get to the end state, to finish with the after, the life that you really, really want.
Back when you were in school, you had a relatively easy way to ascertain where you stacked up against your peers and colleagues. However, now that you're in a practice setting, it's a little bit tougher to know where you stack up, not only against your ideal, but also against your peers and your colleagues. And that's why we created the Premium Practice Score. And if you'd like to take that test, if you'd like to see where you stand up against the best in the world, or perhaps the best for yourself, you're able now to take that and then see where you stack up.